So I'm really excited that we have Dale Roush, one of our network relations managers here today to talk to you about NEMT, our non-emergent medical transportation.
Good morning, everyone. Thank you for joining the webinar today. I hope this webinar will be beneficial to you to learn more about non-emergent medical transportation. The overview, Mercy Care follows access guidelines for non-emergent medical transportation. In our provider manual, general terms, Chapter 9, non-emergent transportation. As all providers that are contracted with Mercy Care, your provider manual is an extension of your contract, and that is also the case with non-emergent medical transportation. Non-emergent transportation shall be provided for members who are unable to provide or secure their own transportation for medically necessary services using the appropriate mode based on the needs of the member. Those modes of transportation is ambulatory van. Ambulatory transportation means a vehicle that other than a taxi, but includes vans, cars, minibus, or mountain area transport. The member must be able to transfer with or without assistance into the vehicle and not require specialized transportation modes. Taxi, a vehicle that has been issued and displays a special taxi license, plate pursuant to the ARS 282515. Two examples you may see while you're out on the road would be VIP taxi or AAA cab. Wheelchair van, the vehicle must be specifically equipped for transportation of an individual seated in a wheelchair. The member must require transportation by wheelchair and must be physically unable to use other modes of ambulatory transportation. Stretcher van, the vehicle must be specifically designed for transportation of a member on a medically approved stretcher device. The Mercy Care member must need to be transported by stretcher and must be physically unable to sit or stand in any other means of transportation is medically contradicted. Covered services, the provider shall deliver medically necessary non-emergency transportation services under the following conditions. The medical or behavioral health services for which transportation is needed is a covered Mercy Care services. The member is not able to provide, secure, or pay for their own transportation, and free transportation is not available. And the transportation is provided to and from the nearest appropriate Mercy Care registered provider. Behavioral health providers may schedule outings to grocery stores, parks, etc., which are not Mercy Care registered provider, but is a part of the member's treatment plan. Only the most cost-effective mode of transportation that meets the individual clinical needs of the member will be covered. The determination of the appropriate mode of transportation must be based upon the functional limitations of the member and not as a matter of convenience for the member. Program-specific requirements, the following must be adhered to. The member must not require medical care while en route. Passenger occupancy must not exceed the manufacturer's specific seating occupancy. Members, escorts, and other passengers must follow state laws regarding passengers' restraints for adults and children. Non-emergent medical transportation must be provided in such a way to ensure that a person does not arrive sooner than 1 hour before their scheduled appointment. A person does not have to wait more than 1 hour after the conclusion of their appointment for transportation home or to another pre-arranged destination. When scheduling transportation, call member services to schedule the transportation. If there are regular appointments for visits like dialysis, all rides can be set up at one time. If the appointment gets canceled or changed to a different day or time, call member services to cancel transportation or have it changed to the new appointment time. To ensure to let them know if there are any special special needs like a wheelchair or oxygen. Verified prescriptions are ready for a pickup before calling for transportation.
That was everything we have today. But I want to say on behalf of Mercy Care's network management team, we really appreciate your time today and thank you for all you do for our membership. We hope you have a wonderful rest of your day.